Welcome everyone to today's webinar, A Tale of Two Provinces, Basic Income Approaches in Prince Edward Island and BC. My name is Natasha Pei. I'm a manager of cities for Tamarack's Communities Ending Poverty. And before we begin, I'd like to acknowledge that we are meeting today on Indigenous land. As settlers, it's important to recognize the contributions and historic importance of Indigenous people and affirm our collective commitment to make the promise and challenge of truth and reconciliation real in our communities. I'm calling in from the traditional unceded territory of the Algonquin and Anishinaabe people, and I invite each of you to introduce yourself in the chat box today, including the traditional land in which you are calling from. While you are introducing yourselves in the chat box, I'd like to thank Tom Cooper and the Hamilton Roundtable for Poverty Reduction for helping to put these basic income webinars together over the last year and a half. If you'd like to learn more about the Hamilton Roundtable, you can visit their website, www.hamiltonpoverty.ca. Now, I'd like to introduce our guest moderator today, Emma Paling. Emma is a journalist in Toronto. Her work has been published widely by outlets like CBC News, Huffington Post, and Vice. As a reporter for the Huffington Post Canada, she produced an award-winning series on participants in the Ontario's Basic Income Pilots called No Strings Attached. Thank you for leading our conversation today, Emma. I will turn it over to you to introduce our panel.
Thanks, Natasha. So I'm going to start by introducing our three panelists that we have today. Hannah Bell was elected as the MLA for Charlottetown Parkdale in a by-election in November 2017, becoming the second Green Party MLA in Prince Edward Island. She was re-elected in April 2019, becoming part of the first Green Party official opposition caucus in Canada, which was a really big deal. She serves as the critic for social development and housing and as official opposition House leader. Hannah is the owner of a consultancy firm, the Solution Agency, helping businesses build capacity and influence change through the power of storytelling, practical training and skills development, strategic planning and partnerships, and sustainable project design. Barbara Halliday is a member of Nelson at its Best, bringing a lens of lived and living experience to the Poverty Reduction Society. As a single mother, Barbara has firsthand experience accessing the many support services available in the community, as well as the isolation and social exclusion that low-income parents often experience in a tourist destination. She believes in the power of community and has organized and participated in Nelson at its Best parent cafes, bringing parents together to connect, relax, share meals, ideas, and learn new skills from one another. Barbara holds a diploma in drug and alcohol counseling and is certified in Level 2 Emotional Freedom Technique. Rhys Kesselman is an emeritus professor at Simon Fraser University's School of Public Policy, where he held the Canada Research Chair in Public Finance before retiring in 2018. He served on the British Columbia Expert Panel on Basic Income, which issued its report in 2021. His expertise is in taxation and social policy, and his PhD is in economics from MIT. Welcome, Hannah, Barbara, and Rhys. Thank you for joining us today. I'm going to start off by giving a few minutes of background so that we all know a bit more before I turn it over to our panelists. So before the COVID-19 pandemic began, two provinces on opposite ends of the country decided to study basic income. They likely didn't know how relevant their findings would be to the public, now that we've all seen what happens when millions of people get thrown out of work all of a sudden. The federal government created CERB in 2020, which many people saw as an admission that the existing supports for people who lost their jobs were not good enough. Back in 2019, PEI had created a special legislative committee to study poverty. The committee was struck with the understanding that poverty is the primary social determinant of health and a complex issue that requires bold solutions. The committee was asked to come up with clear definitions and measures of poverty and to define a living wage on the island and report back with fully costed recommendations on a basic income pilot. The committee's final report came out late last year. It said that the province's minimum wage, $12.85, falls short of a true living wage, which it estimated around $19, although they said that should be studied more. The committee also recommended that PEI immediately start working to create a basic income guarantee and eventually eliminate social assistance. The report laid out how much it cost and how many people would qualify. It said more than 50,000 people, or almost 40% of PEI residents, could receive basic income. It also said PEI should go ahead with a pilot project if it can't get federal funding to start a basic income program right away. The progressive conservative Premier Dennis King said he supports a basic income, but he needs money to create one from the federal government. And if you follow provincial politics as much as I do, I'm sure you have heard that one before. Now over to the other side of the country. In BC, the government hired an expert panel to study the possibility of a basic income for the province in 2018. This came from an agreement that the NDP had made with the Greens to hold power with a minority government. So after 2 years, the panel recommended against a basic income for BC. The report said there are better ways to use policy to improve people's lives. It did recommend a targeted basic income for certain populations, like people with disabilities and young people who are leaving foster care. It focused on the prohibitive cost of basic income, which it pegged at $51 billion for BC. For context, the entire budget of the BC provincial government this year is $69 billion. The authors seem to say that it would be an inefficient way to spend money, $1 billion for every 8,000 people lifted out of poverty. But perhaps what both the studies agreed on is one thing: our current systems need reform. I'm going to hand it over now to Hannah, who's going to provide more information about PEI.
Great. Thank you so much, Emma, and thank you very much for having me here today. It's a real privilege, and I'm coming to you from Abequit, the Land Mi'kma'ki people, and we are on unceded territory, and so it's a privilege to be able to speak to you from here. So as a member of this committee, I think there's a couple of things that kind of really help give context. And you'd mentioned about, you know, the unique sort of structures in PEI. We have consensus committees here, which is in terms of provincial legislatures unique. And that has come because PEI moved from being a two-party system to a three-party political system with the election of the Green Party as official opposition. And there was a commitment from all sides to look at ways of having a more collaborative approach, and that is manifest most obviously in our committee structures, which have equal representation of members from all parties, which means no one party has a majority on the committee. That has provided some very unexpected results, because committees are actually able and willing to take on difficult topics that challenge the status quo, topics that require a lot of work and engagement and commitment. And they have been consistently delivering reports that have really clear, challenging recommendations. So the very existence of the Special Committee on Poverty and PEI kind of came because we had this opportunity to, through a motion, to create a committee which was immediately one that had to work together. The other key thing around this, and you can see that when you look at the context of this committee around coming back with very clear recommendations about how are we going to measure poverty, what is the living wage, and what would a basic income pilot look like, is that's because we didn't know. There was ongoing conversations in the legislature that genuinely people asking, what do we mean by poverty? And it sounds like something that's really obvious to people that maybe work in and around communities and individuals experiencing poverty, but it's actually not obvious. We don't have necessarily the same definitions or understanding or ways of measuring. And while those feel very dry, they're really important. And so having that conversation in a structured way in a committee meant that we were able to then move forward with doing to the end a costed recommendation, because we were all clear that we were talking about the same thing. It also meant that that whole conversation around what is poverty meant that it was a huge learning experience for everybody involved on that committee, whether they were legislators or community members, because we were consistently and continually hearing about the lived experiences of people from our community about how poverty impacts them and therefore impacts our community and its health. So that context, really meant that we looked at this in a very foundational way. And one of the key things that I think is most important out of the recommendation from our report were the principles, the guiding principles, which we determined quite early in our process and then informed everything else that we did. All the math and all the statistical analysis was informed by those guiding principles. And those principles primarily state that any funds that are paid out through any kind of basic income guarantee would be unconditional. And this actually comes from the experience of those who live in poverty, which is the conditionality of existing social assistance programs, disability support programs, all of those programs and the patchwork that we have there is at its core undignified. It is inhumane and unfair. So while we recognize how critical those support programs are, unconditionality was actually a really critical and key principle. Also, that we were looking at a guaranteed basic income, which would be targeted to those who were living in or at the poverty level. And that it would have a basic reduction rate after a certain threshold was reached, which would help with the financial approach to it, but also ensure that we addressed the ongoing concerns of it being a disincentive for work. So there was some really thoughtful work that was put into this, and it's just so interesting to see the difference of approach between PEI and New Brunswick. There's a couple of things in there to be really clear on. The recommendations for basic income in PEI are absolutely done within the existing fiscal envelope. We're very clear that this requires money that PEI doesn't have. But we're also very clear that existing social programs need to continue because they're a critical foundation. And that even with the basic income, many existing social programs would still have to continue because they meet very specific needs for specific populations. The best example would be a program for disability supports, for example, or childcare, or programs to meet specific educational needs. So, though the long-term goal would be that social assistance, the welfare would ideally be replaced by basic income, many of the other programs that we see as in terms of our social structures would remain, which has to impact the cost associated with it. So you are looking at a new and additional cost. The other aspect of this, though, that is really critical is that, and our data backs this up, and we heard about that shocking number of 40% of islanders are at or below the poverty level, is that most of the people who need help and would be benefited from this program are not on welfare. They are working poor. They are regular, ordinary people who you pass in the street every day, who hold one job or more jobs, who are holding it all together and never have enough to actually meet basic living needs. And so a lot of the learning curve in doing this work was shifting that narrative about what does poverty look like, and that poverty is not a small but distinct group of people who have a special need and who are on welfare. It's actually about a whole range of people who are doing the best they can but need that additional help, and that additional help would actually have a long-term benefit to the economy and to society by improving health outcomes across the board, whether they are about direct health or indirect health. So the long-term gain of this investment is about actually shifting how and where we need to invest, because we are no longer in a reactive mode for a large number of major societal challenges, and instead are addressing them on the upfront end with an investment in people. Through a program of security and dignity. So that's the sort of overall context. The other last piece to add to that quickly is that we have, obviously, we knew that this wasn't going to happen right away. And that one of the things that we really stressed with this is that basic income is a tool in the toolbox. It's a tool, it's a big tool, but it's not the only tool we have to address poverty. And so there are a lot of commonalities in some of the things we've talked about since that we will see with BC about how important it is to have those other programs, but also what can we do right now? And to that intent, we actually passed legislation just this past month in PEI, which is groundbreaking, and that's the Poverty Elimination Strategy Act, which is the first act in Canada to actually set out legislative targets to actually eliminate poverty. And it specifically starts with addressing food insecurity and homelessness. And so those are actions and activities that are now legislated as targets and require government to take action. It doesn't set out how. So it means that the toolbox is open. What tools can we use to begin to address moving the targets towards reducing that poverty? And basic income is there, and it could appear in our toolbox in 2 or 3 or 5 years, but in the meantime, we're not waiting. And I think that's a really important part, that every aspect, every piece of work that we do that moves the needle forward, that changes somebody's life. And these are not numbers, but these are people that we're talking about. And so I'm very grateful to be able to do that work, and I look forward to answering questions. Thank you.
Thank you, Hannah. That was really helpful. Now I'm going to hand it over to Rhys for some more information on the report from British Columbia.
Unmuted. Okay, thanks, Emma. I'm pleased to be able to present the analysis and key findings of the expert panel on basic income. And this is found in the final report, which is a result of 2.5 years of analysis and study. And it's a panel of 3 economists with expertise in labor, taxation, and social policy. Our mandate was to address 3 questions. First, should BC implement a basic income of a general variety? Our answer, as you've heard, is no, but we are supportive of targeted forms. Should BC undertake a BI pilot program? Our answer, no. And third, if not a BI, basic income, then what reforms for income and social support systems should BC undertake? We have 65 recommendations aimed at, quote, making BC a more just society. Slide, please. Okay, someone, there we are, yes. Okay, so our goal here is to provide what we deem to be all the requisites for individuals to lead a life with dignity and self-respect. And that requires a mix of enhanced cash supports and in-kind benefits and services going beyond what is currently available. Here are some examples of our 65 recommendations, and in all of these, in implementing them, we stress the need for negotiation and consultation with affected groups, which would be both beneficiaries and definitely taxpayers as well, who are a big part of going forward. I'll mention a few of them. My focus here is going to be on the deficiencies of a general basic income, not on the panel's recommendations. But some of them here are things like a radical reform of disability assistance, raising the benefits to the poverty line, operating it as a kind of targeted basic income, and easing for both that and temporary assistance, accessibility, and basically the decency of the system. Youth aging out of care, which in BC is disproportionately Indigenous youth. We are advocating a time-limited UBI along with mentoring and supportive services. You can see some of the others. I'll just point out one. Health and dental benefits of an extended nature are now available only for social assistance clients. We would extend these to the working poor. Also a rent assist program patterned after Manitoba's program. We also think there's a need to look at employment standards, fishered work, and access to unions. Okay, the BI concept has received much media support, and I expect many of the participants in today's session are favorable to the idea. Yet the focus of my presentation here is going to be on the deficiencies of a general basic income as identified by the panel. And if it's any reassurance, I note that the panel's report has been commended by the leader of the BC Green Party. Okay, so why not pursue a general basic income? And these findings apply not only to BC, but to proposals for a national basic income. Problems identified by the panel: unbalanced focus on cash, inadequate attention to the need for better and expanded in-kind benefits and public services. The basic income elevates the aspect of autonomy and choice by beneficiaries in the form of cash benefits. It assumes that all markets work well. In other words, if people were guaranteed the poverty line in cash, could they actually find in the private market dental insurance without exclusions for pre-existing conditions, counseling, healthcare, transit, a variety of things which a basic income does not directly address. Cash alone is not enough. A basic income minimizes the issues of reciprocity, the economic impacts, and sustainability, and it fails to address the existence of many differential and varying needs of individuals with respect to health and disability, and with respect to income variations within the year, which a basic income delivered by the Canada Revenue Agency cannot deal with. Moreover, its high costs will very likely displace needed and important public services and in-kind benefits, despite the expressed hope by advocates for basic income that they will all be maintained. And when you look at the surveys of public support for a basic income, when they don't mention cost, you get a high response. 2/3 or higher say yes. When you mention in the survey the cost or higher taxes needed for a basic income, support expressed drops sharply to 1/3 or so. Slide, please. Okay, to go any further, I need to introduce some concepts and terminology. My apologies, I'm an economist, but a lot of the analysis does get into that realm. We have to distinguish between two variants of basic income: the income tested BI or IBI and the universal BI or UBI. The IBI has a guarantee amount for a person with no income, but then diminishes that benefit paid by something called a benefit reduction rate at some percentage greater than 0. The UBI has no reduction. BRR is 0%, obviously much more costly to finance. And in the lower part of this slide, you will see just some examples of specific proposals for basic income schemes, both the IBI and UBI variety. Their gross cost, like the Basic Income Canada network with a BRR of 40%, ranging between $135 and $180 billion per year. So this is set at a poverty line. I think their guarantee is $22,000 per year. The UBI format is $640 billion per year. For perspective, $180 billion is the total amount collected each year by the federal government from all personal income tax. So you can see these are massive amounts to finance. UBI Works has two variants there. They propose a higher BRR, 50%. Then I note two of the provincial proposals. First, for BC at a $20,000 guarantee, a 30% BRR, the gross cost would be $17 billion, or with a UBI format, $51 billion. So these are very large relative to the provincial budget. BC collects $12 billion in total in income tax each year. For Prince Edward Island, the legislative proposal is a guarantee somewhat below the market basket measure of poverty, and would have a net cost of $260 million. By my calculation, if PEI had to finance this itself, each household would have to pay an additional $4,300, and if you restrict it to those who are above the taxable level of income, more than $6,000. So we understand why PEI is knocking on the door of the federal government, but regardless of how it's financed, this gives you an idea of the magnitude of the financing between provincial and federal taxpayers. Slide, please. Okay. Now, what are these disincentive effects? This is really a major concern that has been underplayed by advocates of BI and attempts to minimize it and simply sidestep the issue. Okay, these disincentives are not particularly evident in past pilot projects because they are small, they're short-term, and in particular, they're not financed. The disincentives arise as much or more on the financing side as on the benefit side. And they would affect a wide range of labor and non-labor responses. Here, the concept to introduce is the impact on how much of an extra dollar of earnings an individual could retain. And the concept or the term is the marginal effective tax rate, the METR, and we say meter if we're an economist. It's the percent of an extra dollar of earnings that an individual loses through both higher taxes plus reduced benefits. Okay, I will note that most BI proposals in Canada would eliminate the basic personal and spousal credits in the income tax, and that's a significant part of how they finance themselves. And that has important implications. Slide, please. So once you're into this area of considering the disincentives of both the benefits and the taxes and the charges that people pay for employment insurance and Canada Pension Plan, you get total meters. In other words, how much of each extra dollar earned a person cannot retain, how much they have to forego. And in the green line there, you'll see for the various proposals, the Basic Income Canada Network, both the IBI and UBI formats, the UBI Works Group, and the PEI proposal, you'll see that the meters are very high. In fact, they are higher than is typical in provincial welfare programs, where they typically run, depending on the province, between 50 and 70%. So disincentives could actually be worse under an IBI or the UBI format than under welfare. Also note that under the UBI, the BICN version, the meter is even worse than under the income tested forms. And that's because to finance it, they would need to raise the first bracket federal income tax rate to 75%. Okay, then you see a red line there, which applies only over a higher range of incomes, but still in the range of poverty families. You see if the beneficiary family has 2 children, the child benefits of both the federal government and provincial governments kick in, and they also have BRRs, which raise the METR to grand levels that approach or even exceed 100%. So these are of real concern. So if you think about it, what would an 80% meter mean? It would mean that an individual who's maybe earning the minimum wage, which in BC is about $15 an hour, if they consider and look around, find another job that pays an extra $1 an hour, how much can they keep? Just 20 cents after these various benefit reduction rates and tax bites kick in. And another important thing here is under the basic income schemes with their financing, these meters affect not just people at the bottom end of income, but they also affect a far larger group of the working poor population and the above poor population. Slide, please. Okay, into the home stretch. Summarizing, why prefer targeted basic incomes and enhanced in-kind benefits to a general basic income, the high cost. So the full list of 65 recommendations for BC by the panel would cost roughly in the range of 3.5 to 5 billion a year. Contrast that with the $17 billion figure for a general BI at the poverty level. Lack of public and taxpayer support when people are apprised of the costs and taxes, another problem with the basic income. And despite expressed hopes, a basic income with these costs would end up displacing in-kind benefits. And in fact, they need to be expanded. The disincentives of an IBI or UBI at the poverty level are actually worse than those of the existing welfare system. A basic income administered by the Canada Revenue Agency as a refundable tax credit would not be responsive. And we think that the basic income places excess emphasis on autonomy and the market for goods and services, and it elevates cash over all requisites for self-respect and human dignity. So I hope that these findings will open discourse on an ambitious but more realistic set of achievable policies for poverty reduction and for addressing the needs of our most vulnerable citizens than the proposals that have been made for a general basic income. And I welcome questions. Thank you.
Thank you so much, Rhys. I'm going to move over to Barbara, but Rhys, can I just ask you one question quickly? Can you explain what you mean by disincentives? Do you mean disincentives to work?
These, the meters, that is how much you lose if, well, it's how much you would lose if you're out of the workforce and go to work. That's called the participation tax rate. Or if you are in a low-paid job and you look around, you find another prospect, but maybe it involves commuting more, maybe it's a less pleasant job, pays another couple bucks an hour, you're only going to be able to keep 20% of that. Are you going to move? Are you going to take these additional actions? Are you going to take a training course? Are you going to upgrade your skills? Are you on your existing job? Are you going to do the things that get you promoted, which maybe mean taking additional efforts and the like? So there are many, many margins that these disincentives affect that really have not been studied, investigated, or measured properly.
Okay, yeah, that really helps me understand, because I often hear disincentives for basic income more narrow, as in, why would you leave basic income to get a job when you already are getting this money? But you're also looking at the higher taxes that will be a burden on people after they leave BI and get a job.
Right, it's very sweeping. People respond to incentives, whether they are rich and trying to minimize their taxes, or whether they're middle incomes, or whether they're poor and trying to make every penny count. People make these trade-offs. We're all economic beings.
Okay, thank you so much. Barbara, we're going to go over to your portion now. Can you tell us a little bit more about your experience as a single parent and what it's been like to try to get support from the government?
Sure, thank you. Yes, thank you, Hannah. Thank you, Natasha, Isaac, Reese. I'm Barbara Halliday from the Nelson at its Best, from the Sinninks territory, Arrow Lakes Band, and as a single parent, it has been rather challenging. I started off actually, for a little history there, I started off on going through different challenges from, as far as I can understand, some challenges from poverty-based mindset that's created some shame and some, I guess like the poverty, shame, and a lot of pressure, and how that's affected my aspects of having to go to welfare system in the first place and how difficult that is. Of course, nobody wants to be on the welfare system. Nobody wants to be having to situate themselves there. And how I can see how the systems of different people that I've known have fallen through those cracks. And I can relate in the fact that it is difficult to go through the kind of the merry-go-round of the paperwork and the phone calls and the being put on hold and then having a child and having to bring your child to the offices. And yeah, it's been rather difficult. Some history of mine was I was on the welfare system for the first while I was pregnant. Actually, it was difficult. I had to go actually live at a maternity home because I couldn't afford the rent. I was living in Woodstock, Ontario at the time, so I had to go to St. Thomas. That was the closest place to find a place that was $5.50 a month for rent. And so that was my start. And yeah, you have to go every month and fill out the papers, and it's a lot of rigmarole, a lot of time, adds a little more pressure. There's a lot of people that I think are on the assistance that either have mental health or addiction issues or diagnosed with anxiety or PTSD and things like this. And of course, the whole system gets difficult because there's not a lot available, and a lot of appointments, let's say mental health, or there's a lot of programs that are designed to help people for sure, but it becomes a little difficult between getting, of course, childcare and or getting a way to get to the programs. I actually was saying yesterday how grateful I was since Zoom and telephone conversations have replaced a lot of people to people appointments, because then you don't have to drive somewhere, you don't have to bring your child there, you don't have to take all that time. You can just pick up your phone and go for a walk and have your headset or be on Zoom at home. It does make things considerably difficult. Some of the some of the paperwork and some of the like having to push through things, it does prove difficult. And sometimes I felt like if we had one system that was more together rather than having numerous different systems that one has to apply for, even the child benefits, it becomes a lot of paperwork, and it's not always easy to figure out even the basics of how to send the paperwork in and going to fill out the next forms, and it's changed again because they've raised their prices up a bit. So how much time and effort it takes, that really takes away from your own parenting, and takes away from your own life. And I guess when you add up all of that, it gets to be quite a bit. Now, I do recognize too, I'm part of the low income dental clinic in Nelson, BC, and I've really appreciated that. Before that, like I had some teeth pain, for example, before I had my daughter, and I couldn't get anything worked on, of course, because you can't get any x-rays done because you don't want to harm the fetus, right? So you have to go through and have the child. Then afterwards, at that point, I had to get it extracted. Now, I could have gotten a root canal, but of course the social assistants wouldn't pay for a root canal because they're very expensive, of course, right? So I had to get the tooth extracted. And then later on down the road, I did get the root canals through the low dental income clinic. So it was $1,000 for the crowns, rather than, I think it was, I don't know, $1,500. So you save some money there, but you're still going to pay for things, right? There is some other programs, I suppose, that I went through, and that was the Single Parent Initiative. That was another program that is absolutely amazing. I actually got told by a friend that read it in the Globe and Mail. This was about 5 years ago. And he said, oh, you apply for this, and then you can get some updated on training. Because I had a drug and alcohol diploma, but I couldn't get work as I didn't have a degree. So it was very difficult in Ontario to get actually any work. And so I was like, okay, I'll go back to school, but the list came out, and it was, well, actually I went to social assistance and asked them about it, and they hadn't heard about it yet. So they didn't actually know. And then I went to the Work BC and I was like, okay, I've heard it, and they hadn't heard about it. So if we could only look at how many appointments that I went in with Work BC after they knew about it, and the list, and how the list changed, and how there was like 120 different careers they'd be willing to train for: doctors, lawyers, career counselors, childcare workers, home workers, all this kind of stuff. But then you figure out, well, if you took the 7 years or whatever it was for the doctor, they would pay for the last year. You know, it's all these like little things that you're trying to figure out. And then once you figure out, well, okay, I'll take this course or that course, you realize, well, I'd have to take a bus into Castlegar, I'd have to get childcare. And by the time then there's like, well, you also have to study for 15 or 20 hours or whatever it would be to do the homework on the weekend. And they're kind of going, well, why don't you, get somebody to help with the child on the weekend? And you're like, well, you're a single parent, like in my circumstance, the father's from the Dominican Republic, actually. And my family's all in Ontario. So you're not going to send the child to your, the aunt or uncle or whoever you could send the child to. So it's again, those 20 hours that are taken away from that child if you want to get educated. It just becomes a little quite frustrating. And there's all kinds of things I could go on about, but I ended up getting some help because I realized if I got a doctor's note, I could be classified with people with persistent barriers. And that did make life easier because then I didn't have to send in the monthly work where I went and applied for all the jobs and all this kind of stuff, right? But you still have to do the income, put the income in. And if you forgot, then you've got to go into the office still, and you still got to figure out all that. So, and then I guess, as a single parent too, you're running around to get the food banks, or, very fortunate to have food banks, very fortunate to have a school lunch programs that will help out too. And you do your best, but you can also, it becomes a loop because you realize, I do some housekeeping on the side, but you can only make so much money in order, and then there, you don't get any help. So then in my mind, I was like, well, am I just going to exhaust myself to what point? And then it becomes a parenting thing too. And, some people, they go right through it. Other people, there's more of a struggle, and then there's more pressure. And then when there's more pressure, then everything gets more difficult. So I do like the idea of the basic income, because then it just becomes a little more simple. You don't have to fill out as many forms. And I can't say that I don't love the programs, because they really have helped me out too. So I imagine that there's a balance that needs to be seen. Childcare benefit has been lovely. I really love the fact that it was increased with the child benefit to, that was extremely helpful. And it's way better than it was before the 70s, I suppose.
And how would it have changed your life if instead of welfare, you got a higher amount and you didn't have to go to any of those meetings? You didn't have to constantly prove that you were looking for work. What would that have meant to you and to your child at that time?
Well, I think that, let's say like around $1,200 welfare, and you get $570 or so for the rent portion. So, I probably, like, I was in basement suites. And then the last basement suite I was in had black mold. So I would have chose to get probably a different apartment, different place to live. I'm geared to income housing now, but I had to fight for that, I'll tell you. Like the woman said, I was going to call harassment on you, Barbara, if you called me one more time. But when you got to find a place, you got to find a place, and I think, it would have just been quite a bit less stress. I am one type of person that really does struggle with paperwork. It really makes it's just one added pressure. It's like, okay, I have to sign that, or I have to fill that out. And now, I had Beatrice at a before school program, which is great. And, she's going to send me a new form to fill out so I can send it into the child benefits again. And then if it's going to be camp, we've got to apply for that. And if you have 2 different camps that you want her to go to or want them to go to, then you got to apply for this. It would be nice if things were a little more simple. Yeah.
Yeah. And it sounds like even when you had your friends and had your own research, some of the government programs weren't even aware of the other government programs.
Yeah, the communication between, the two. It's interesting that the Globe and Mail would have known all of that before the actually employers at the social assistance. And it does get frustrating. And then also they had a list and then they revised the list. And it's just, everyone's doing the best that they can. And it's a wonderful idea. I ended up actually, in all honesty, I grew up and I had learning disabilities. And when I was in grade 2, they put me in a different class, a learning disability class. We're called the resource room. And that was another part that, okay, well, could I even do as a single parent, could I do a regular course without assistance, right? And then after, I don't know, 20, 30 meetings with the employment counselor, we decided, well, if we push for it, maybe I could do it part-time. Right. So that's kind of where we left it. But
20 to 30 meetings.
Oh,
that's a lot.
Yeah. And that was 3 different career counselors because they get moved along and up and however else that goes on. Right. Because things change and move. And but then it becomes the amount of paperwork that you have to go through to prove that you would do well, and then have other people tell you, like, I don't know if you've seen the paperwork that you need to go through just to get approved. As it just becomes, again, just more things to fill out. Yeah. So
thank you so much, Barbara. I'm so happy that we heard from you. I think it's so important to hear from people who have been through the process and can shine a light on that side of it. We are running close to 1 p.m. So I am just going to do one short question for each of the panelists. Hannah, you had talked about conditionality. And I think this is what Barbara is also getting at. There's all these conditions when you're on social assistance, you have to constantly look for work. Can you tell us what are some of the conditions in PEI and what difference that might make, or what you heard from people about that in your committee?
Oh, wow. Well, I'm nodding enthusiastically with Barbara because I literally work with constituents every day who tell me that being poor is a full-time job. Like you have to commit so much of your life to meeting the requirements that other people put on you so that you can just sort of get through all those barriers. And it is barriers. I mean, it's things like needing to prove that you are still in the same circumstances on sometimes monthly, that the paperwork has to be submitted in person, that your case file is not consistently with the same person. So every time you have to go to a case file meeting, you have to talk to a different person and explain your situation all over again, which is really unfair and stressful. It's needing to demonstrate need. Sometimes, for single parents in particular, having to explain why putting your child in childcare does not make you a bad parent. Or on the other side, explaining that you need childcare so you can go to work because they want you to go to work, and then they're giving you grief about getting childcare. Or, do you really think your child should go to camp this summer? Why can't they stay home with you? Really invasive personal questions about things that are personal choices, and nobody else has to do that. Nobody else has to demonstrate why the choices they make in their life don't meet the criteria for somebody else. And you know, that's when I talk about dignity. That's what I'm talking about. Nobody gets to tell somebody else that their choices are the right ones. And being the person who has the power, who can make decisions about whether or not you're going to be eligible for the money you literally need to be able to get dental care, or to buy the right food, or to get household cleaning supplies, or to send your kid to camp, or whatever it may be. The power dynamic is awful. And so, you know, when you add that you've got this stress and anxiety of just having to navigate this all the time, it is incredibly distressing that we think that that's absolutely okay as a government policy. And be really clear, poverty is a policy choice. We make choices through policy, and then the financial decisions that come out of that policy to continue these systems. So these systems have been in place for 30 and 40 years. I look at policies under our social systems program here in PEI that were written in 1993 and have never been updated. Okay, that's a choice, and it's not the right one. So I'm so grateful to Barbara, and I'm so frustrated that everybody I talk to anywhere has these same stories, because how could we do that to people who are part of our society, who we value? We can do better. There you go.
Thank you. So we are very quickly running out of time. If you do have any questions for the panelists, please do put them in the chat. And even if I don't get to them in the next 8 minutes, we will send out written responses to all of your questions when we send the recording in a few days. So you don't have to not send your question just because we're running out of time. There was one question submitted in advance that I thought was interesting. Rhys, I'm wondering if you can speak to this. And if you can't, I'll give you another question. This is from Russell in Cranbrook, BC. Has research been done on the impact basic income would have on businesses currently paying wages below the basic income amount? How many people are in jobs but make money that is less than they would get if there was basic income? What would the impact of that be on businesses? Was that anything you came across?
I would say there's not enough known about that. I mean, we certainly know how many people make who are working, and many of them working substantial hours and weeks, but making less than the market basket measure. But it's kind of speculative, the question posed there. There was one on the chat box that I would like to address. May I read it? Why do you think the BC's report with over 100 recommendations can be achieved when these proposals have also been made by anti-poverty advocates for over 30 years and have been ignored by government? Is it not plausible that the failure of incremental reforms is in fact why many of the poor are asking for a basic income today? This comes from Craig Bergold. I don't know where he's from. Thank you, Craig. Well, there's an old saying, the best is the enemy of the good. A basic income at the poverty level is, let us say, almost utopian. Even the most prosperous countries among advanced economies do not have a poverty level basic income with no conditions. In other words, not targeted, somewhat like income assistance in some ways. So even Sweden, which has devotes much more of its total income through taxes to the welfare state, does not have a basic income. Instead, they devote a lot of efforts for people who are out of work to retraining and assisting them in many ways to get them back into work as quickly as possible. They have much more active labor market interventions, and they do have cash support, certainly for targeted groups, but they do not have a general basic income. Why is this? Well, I think what the BEI panel for British Columbia found is generic reasons in terms of cost, incentive issues, public support, tax burdens, et cetera, why they don't exist anywhere in the advanced world. And why would we expect these challenges to be overcome in BC or in Canada? So why not argue for improved dental care for people at the poverty line and above who are not on welfare? Why not argue for subsidies for single and couples without children in BC who do not get rental subsidies, whereas people on welfare do, and people at the poverty area and higher with children do. There are many areas that we can move forward, and we do believe that we do have a receptive ear in the provincial government to the recommendations in the report, and I would be surprised if at least some of them are not taken up in the next period, the next few years.
Yeah, I was going to ask, actually, do you have firm commitments from the government on any of the recommendations yet?
Well, I don't think that's how governments work. They do their things behind the scenes, and only when you have a budget announcement where the commitment is, they would certainly do consultations and internal staff analysis and the like, but they're not going to foreshadow things. And of course, right, in budget making, there are many competing demands.
Mm-hmm. Got it. Okay, Barbara, I think I want to end with one question to you. You talked about your experience talking to your caseworker and going to 20 to 30 meetings only to kind of realize that the retraining or going back to school wasn't going to be realistic because you have a child. What would be a more accessible program? What type of going back to school program would actually help?
Oh, yeah, that's a very good question. I guess I would start off with when I went to school originally, of course, I almost want to say the whole school system has to be rearranged because there's a lot of pressure, of course, on people in grade 9 knowing what they want to do for the rest of their lives. It's not super realistic unless someone is super enlightened or something. But I went for a year. I took waste management, environment, waste management, and then I took the drug and alcohol counseling. And of course, I did it through OSAP. So once I got out and I didn't pay things off, I went into the bad credit area. And that took a long time to pay off. I ended up getting an inheritance from my grandmother and my mother. So that paid off the bills. So that was lucky. But I guess paid education, moral thorough from the very beginning, kindergarten up, of just having a better education of life skills and getting to know oneself, what is really their highest purpose, what they will do well in life, and having to not have to think too hard about the finances to do it.
That's really helpful. Thank you so much. It's 12:59, so we are going to wrap up. Thank you so much to our panelists and to everybody who joined. Once again, I'm sorry for not getting to all of the questions, but please drop any last questions in the chat and we will get written responses out when we send our final recording. Thank you.
Thank you very much, Emma. Thank you to all of our panelists today, Rhys, Hannah, Barbara, and again to you, Emma, for steering us through. Everybody on the call, you can continue learning about basic income with us, with Tamarack and the Hamilton Roundtable for Poverty Reduction. On June 3rd from 6:30 to 8 o'clock p.m. Eastern Time, the Hamilton Roundtable with the Basic Income Hamilton and the Social Planning and Research Council of Hamilton are co-hosting a virtual book launch for the new book, The Case for Basic Income, Freedom, Security, Justice. I have a copy and it was a fantastic book. So the book features stories from Ontario basic income participants, and several of them will be actually speaking during the book launch. So the registration link will be sent to you in the follow-up email. You can also save the date for an international dialogue on basic income with RSA Scotland's Jamie Cook and the UK's Basic Income Conversation co-founder, Michael Pugh. It's been more than a year since a state of emergency was declared over COVID-19, and basic income was thrust into the forefront of discussions in households in Canada, across the world, and into government debates. So we're going to look at where advances have been made in the last year, including in the UK and Finland and the USA. So that registration link will be coming soon. If you're interested specifically in food security and its connection with poverty reduction, we are going to be hosting a webinar soon on with the co-chair of Canada's new Food Policy Advisory Council, the co-lead of the Northern Ontario Indigenous Food Sovereignty Collaborative, the executive director of Food Share Canada, and a senior policy analyst for Community Food Centres Canada, talking about the national food policy and discussing what it's going to mean to end food security in Canada. So a full list of upcoming webinars with Tamarack Institute can be found on the event listing. The link is on your Zoom there, and we'll send it to you in the follow-up email. And I thank everybody who is listening and learning along with us today. And you can send your questions, comments, and feedback about this webinar to natasha@tamarackcommunity.ca. We're always looking to improve.